Hey everyone. So it's me, Delight Mells from SDS, and I'm here with several of my colleagues, Cassandra Lynch,
Hello,
Kara
everyone.
Thrasher. Yeah, hey Cassandra. And Kara's here. She's in the background, and so is Anna. So we're all here with you today, and we wanted to first of all wish you a happy new year. I know we're 17 days in, but we wanted to first of all tell you happy new year and congratulations to making it to 2023. And we are letting more people kind of fill in here for a few minutes. If you have any questions that you're hoping for us to answer for you today, maybe about some of the e-alerts that have been coming out, maybe about something that isn't, maybe just something that's on your mind as a provider, feel free to put that into our questions box. How do I access the questions box, you may ask? This is different than Zoom, these webinars. You can access it by looking for a orange box with a white arrow, and it will collapse and expand your controls. And in one of the panels, you'll have a question area. So while we're kind of just letting people come in here, would you mind testing for me that you're able to hear me by typing into the questions box? All right, a couple of questions. Awesome. So you guys can hear me. That's great. I see a couple of good questions coming in here. Some of them are related to, can we get a care coordinator liaison in with DPA? They have brought that to the leadership team and they're exploring that. Know that Kat's position is funded through the Mental Health Trust. So a lot of those kind of positions, there's a lot of exploration and finding funding sources. So that being said, if you think there's a need for it, please continue to advocate for it. That's always really important to make sure that your needs are known as a provider, because if you have needs that aren't being met, then it's really hard for you to help Alaskans get their health and safety needs met. So please continue to advocate for those kind of questions, especially related to Medicaid, because that's really the driver of our work, right? Like, you have to be on Medicaid in order for your clients to be able to access long-term care services. So looks like you guys are here and it's 2:02. We sent out, there's an agenda in the downloads box that you can download, as well as
In the
information.
handout.
Yeah, thank you, Cassandra. As well as attestations and electronic signatures. If you're a care coordinator and attended the info share this past week, or excuse me, 2 weeks ago, then you are probably already familiar with materials. We're covering it again so that providers also are aware of attestations and how those are working. But before we get too deep into that, I want to let you know that we have issued the e-alert regarding the public health emergency extension. It has been extended, so that means that it's running all the way through mid-April 2023. They're assuming that it's going to go through that. And because there's a 6-month transition after a PHE ends, we can project that the extension goes all the way out to July 1st, 2023. So at this point in time, you can, as a care coordinator and as a planning team member, providers can expect to use the App K form for the next 6 months. So that's a guarantee. There is movement towards preparing a short form, which would be a permanent support plan method. That if that is implemented before App K is completed, there's going to be a big transition for it. You will all know, everyone will get a lot of information about it, and you can rest assured that we'll be working with you to make sure that there's a smooth transition from AppKs to short form plans. As always, when it comes to AppKs, if there's any change to the delivery of the service, so we are going to be requesting more hours, or if there's been significant changes to the client, you should submit a full support plan, okay? So a couple of questions in here so far, taking a look. So far, so good. Okay, so now that we've addressed that AppK is extended, all of the flexibilities that have been leveraged during the PHE are extended. So that takes us to preparing for the long term of when the extension is over. One of the flexibilities that was implemented at the very beginning of the pandemic was verbal attestations, okay? So that was the option to verbally confirm that you agree to a document. It is required, and has always been required, that at some point in time, you will need to have that verbal attestation either signed in hand by hand, like signed, right, written by sign, or electronically signed. Before the pandemic, there wasn't an option for electronic signatures. That is a flexibility made permanent, and so you will always be able to leverage electronic signatures. So what can we do for preparing that transition? We've already talked with care coordinators last week about having a case file review whenever you're preparing for a planning team meeting to look at the previous support plans. So we're talking 3 support plans back now, and making sure that if anything was verbally attested to by a client, that they sign that document, and the care coordinator holds that within their records. You as a provider, home and community-based waiver services or PCS services, if you used a verbal attestation with the client, you should also be looking at your records and making sure that they signed that document and that they agreed to it. There is a limit here. If the person is deceased, if they change providers, you do not need to go and have anyone sign those previous attestations, okay? So if they have to be a current client for you to have to go back and document that that person did verbally attest to it, and they're acknowledging that they did that by signing it. So I'm seeing a couple of questions. Okay, so some good questions. And we'll kind of come back around to cost sheets at the end. So that was one of the questions that were put in here. So I'm just marking that. All right. So that kind of takes us through this first component, and we wanted to give you like a fully written down agenda so that you can keep this document for your reference. But when we're talking about, let's see, there have been some questions about, well, how do I obtain signatures? As always, check with your clients about what their comfort level is with you meeting with them in person, or if they're comfortable doing electronic signature. Really, you know your clients best, and you have the best rapport for that with them. So figuring out how to make that work as far as either doing an electronic signature or doing a handwritten signature, it's up to you in trying to navigate that. So that pretty much covers the in-depth components that we have about attestations. If you had, I want to make sure attestations are different than electronic signatures. They're separate concepts. Electronic signatures are here to stay. You can authorize a attestation with an electronic signature. They have to be done by the client. Okay, so any questions about attestations? So the question is, can you explain electronic signature, please? How does that work with confidentiality? So SDS and the state of Alaska, we can't tell you which electronic signing system that we can't mandate that for you, okay? There are a lot of different types of electronic signatures applications out in the world. And so it varies from, some of them include DocuSign, there's Adobe Pro, there's I think there's like a Foxit one. There's a lot of different types of authentication for electronic signature. If you're going to be using an electronic signature, proprietary electronic signature software, it's really critical that you talk to your client to let them know what to expect, because just like you, they're exposed to all these different types of electronic signature systems. The key component about communicating in this is that you're doing it in a HIPAA manner. So you're sending those documents in a secure way. All right. So that's our HIPAA concern here, is that we're sending our documents through secure DSM methods. Okay. So that when the client receives it, there isn't a chance for them to be, for it to be intercepted, that you're breaching their private health information. Yeah, and it looks like some of my teammates are answering some of your questions already. One of them happens to be, when are electronic signatures allowed? They're allowed. They're locked in. The regs have changed, and so those are here to stay. Electronic signatures are permanent. Other questions that we might have.
I'm not sure if I missed it or not. I apologize because I had a call come in. But did you address about the leap year?
I did not.
Okay, so people are having questions about the 366 units versus the 365 units for the leap year in 2024. Basically, they want to know, how are they to do this? How can they make their plan work with that? And then someone else says, let's see, let me go down. Yes, 2024 is a leap year. Am I missing something? Can providers be remanded? Okay, that's a different question, but they're asking about the leap year.
Okay. So this is a harmony question. So let's make sure that's really clear, because some people are like, what are they talking about? When we're talking about leap years and unit calculations, that is specific to when the system has when you're doing a time calculation, it'll sometimes over calculate, and that has been very difficult to navigate for a lot of services. Like, you cannot trust that it auto calculated it the correct way, because it factors in the leap year. So we have a leap year, which is February 29th, okay, in 2024. So your calculations right now continue to calculate it. You shouldn't use that partial unit. It'll just make sure you're calculating it manually and verifying that the total units that you want are accurate. And 2024 will be the time for the leap year to shine in the Harmony data system. That being said, I have heard reports that it's acting a little unusual, and I don't have additional information on why. So your best practice is to continue to factor in how many units per week is going to meet the person's needs, and then calculate that out for 52 weeks a year. Okay, so best practice, best practice is to do weekly average and calculate that out from there. Okay, just checking.
Okay. Another question is, and I might have missed it, but it's flagged. Can providers get a reminder that they are signing off on the support plan / amendment and not the cost sheet? Still having providers require a cost sheet prior to signing plans. I recall being told that the cost sheet was not necessary for the provider to sign off on the plan.
Thanks, Cassandra. Yeah, so I was
You're
hoping
welcome.
to kind of answer that one at the end, but it's okay. We can talk
Okay.
about it now. Let's just talk about it. So, what's the deal with the overview sheet? The best way I can describe it is that this overview sheet is being used for different reasons depending on who you are that's working with it. It is just a summary. The rates that are on it do not reflect what the rates may be in the future. So if you had a support plan with an overview sheet that was written, yesterday, and then in 6 weeks, the rates change, you're always going to be reimbursed based on the rates of the date the service was delivered. So with that being said, the overview sheet is just the overview of the plan. It's really important for the providers to look at the support plan itself and look at their specific, look at the whole thing, because you should kind of be aware what everybody's doing to support your person and to make sure that there's a continuity of service. So read the whole thing. But providers really need to key in on their sections on the units requested, what the service will be doing to help the person, because that's kind of how you're meeting their needs, and the expected outcomes. Okay, so looking at that and making sure that's accurate, and also making sure it's accurate about the conflict of interest questions, because you're the provider, you're the agency, the provider relationships that you might have with clients, and making sure that information is accurate as well. So that's what you should be keying into. The overview is not a tool to authorize services. It's just a summary. It's possible in the future that that entire overview page might evolve into something different. But your practice of going through the support plan, getting a full understanding of how the support plan, other services, support the person, right? And making sure your elements of it, including the units, how services will be delivered, and other components of that, as well as the conflict of interest questions, are all accurate, and that's what you're signing off on. Yeah, so people are asking, well, are we talking about the billing document? Yeah, it's been the Uni 14. It's like an overview. That document, it's intended to give a summary to the person of just a quick at a glance, like a insurance statement. But like I said at the beginning, everyone's come up with different ways to leverage that resource for different reasons. So as a provider, yeah, it's helpful to get a look there to see if you're in the right ballpark as far as the units, but your responsibility is really to go in depth into the support plan and making sure that your agency, when it signs it, is able to meet those requirements, because that's what you're signing off on, is that you're going to be able to deliver the services as defined in the support plan. So what are your thoughts, Kara?
I just wanted to say that we do have a recording of the webinar that we explained what you just talked about. So if people want to go back to it, it was on October 18th, and I put the link in our chat. That's all.
Oh, great. Thanks for that. So before I get back to another question, and just so my team knows I'm marking it because it's a really good one about CIRs. So I'm coming back to that one. But before I do have two other announcements on our agenda. One of them is about our provider office hours that are every Thursday, and the Zoom link is included on the agenda, so it's like down here. The Zoom link always stays the same, so you don't have to get like a new one every week. You can save this as like a calendar reminder in your Outlook. We haven't had very much attendance, and that's to be expected. You guys haven't worked with us that much in this capacity of working with all different provider types. So we wanted to just encourage you again to consider popping in and saying hi. If you're fuzzy on any specific Medicaid requirement or service delivery questions, or even case consultations, you're not sure how best to approach a specific situation, come visit us. We always have at least one person there, and you're really our priority to make sure that your needs are getting met. And if you just stop in and check in and say, hey, I was just checking to see what this is all about and see if anybody's here or talking about anything, that's fine too. We do keep it HIPAA, I want to say HIPAA compliant, like we keep it HIPAA cool. So if you come in and there's several people there, we can break you into a separate room so that you can talk about PHI and we can help you with that specific scenario, okay? So just another reminder about provider office hours. And then finally, we do have some information about Full Lives, and that is a conference that SDS sponsors in collaboration with the Alaska Training Cooperative and the Centers for Human Development through UAA. This conference is an opportunity for direct service care providers, admin, people served, and state agency officials to all work together and complete some professional development on topics of meaning. We do have a committee that has been in planning mode and starting to prepare for that. And we do have we have several providers a part of that committee. And I would encourage you all, if you choose to attend, that you think about maybe participating next year to participate in like the conference building process. When will this conference be? It's going to be April 3rd, 4th, and 5th in Anchorage. And it is at this time planned to be a face-to-face event, and you would have to register with the Alaska Training Cooperative. There's usually a theme every year, and this year, although it hasn't been formally released of what the theme will be, know that it's about supporting our workforce and looking into the future for that. So just know that it's a very engaging and inspirational experience. You're able to challenge yourself in your understanding on concepts, and so we highly encourage you to attend. Care coordinators have both CHE opportunities and separately an opportunity to complete their training requirements to renew. So 2 opportunities for care coordinators with that. So that's the agenda that we have all together outlined for you today. I know I went through that pretty quickly. So if you need a minute to let me metabolize what I just absorbed there, please feel free to kind of take it in. If you have, like I said before, any questions about topics or concepts or themes that you want to discuss today, feel free to drop it into the chat. One of the questions that I thought was really excellent that I saw in here was about non-injury falls. Someone falls and they're not injured. Do I need to put in a critical incident report? So the answer is, you have to seek medical consultation for the person if they fell. Now, maybe they didn't get injured, but man, it was such a bad fall when you saw it happen. You're like, whoa, we're taking you to the doctor, like we're getting you, then yes. If it was to the point where your team was worried that they needed a medical consultation, even if they were not injured, then you need to file a CIR. If they fell and they seem fine, everything's fine, then no CIR is required, okay?
They're like also to that, even if they called a medical doctor, if they had to call a doctor about the person, even though the person didn't go in, if you made that call because that person fell, you must do a CIR.
Yeah, so, and I'm seeing a reminder that it's important to contact the legal rep because the legal rep may ask for medical consultation and that's their call. So yeah, they
And
fell.
the care coordinator, if they have a care coordinator, please contact their care coordinator as well.
And that's for sure, either way. So what do you do? Like, maybe I don't feel like I don't feel like we're at the stage where it appears that we need to consult a medical provider. You know, you guys know, you're all professionals. Sometimes people are fine the first couple of hours, and then a couple of hours later, it turns out to be a problem, right? So, you know, at the moment, you know, they fell. You don't have to file a CIR right that minute if if you didn't consult a medical professional, but you should contact the legal representative and the and the care coordinator. You should let them know, okay?
Okay.
Because the
So,
legal rep may say that you need to have a medical consultation.
right. Also, the question is if they are in an ALH and the house nurse checks the person over and found no injury. Well, 9 times out of 10, if they're in a ALH, they're going to write up an incident report anyway in assisted living homes because that is under the nursing rules. That is under their ruling of what they need to do.
Got it. So what do you do if you have the situation where it evolves, right? You're like, they were okay, but now we're having problems later, and you know, they did fall, so now we need to do a medical consultation. You file your CIR as soon as you're aware of the situation. In this case, you know, the person fell, and then a couple of days later, you take them to get medical consultation. That's when I'd file a CIR. And that's 24 hours within the incident. So yeah, there's some time lag there, right? Like, they fell, but like 3 days later, they're still having a lot of health issues. I think it's related to the fall. When you make the decision to do a medical consultation, that's when I'd file the CIR and just give the full story of what happened. Okay, it's all right. I want to empower you to know that it's okay to over-report. We would prefer you to over-report. When in doubt, report. When in doubt, connect with the care coordinator and the legal rep, because what we want to do is make sure that we have a continuity of care for the person. If they're in long-term services of care, they're working with us for the long haul, so we need to ensure that we're helping protect their interests and their health. And when it comes to CIR, that report, I know it can be kind of tricky to get it into the system. You can always call the intake line and they will help you complete or take your critical incident over the phone. They're going to do everything they can to report the situation because we're trying to make sure that we're collecting data on the safety of Alaskans. Okay, so yeah, the be all end all is, if when in doubt, file the CIR. Okay, that's the be all end all. Yeah, go ahead, Kara. She's on it. She's like,
I was just,
okay,
I was just looking. I
confirm.
just wanted to let you know that I'm here, and you know, there's a nice question underneath that has a couple of
Right.
parts that we could
Want
probably
me to read
both work
those?
on.
Okay, I can read them for you guys.
Okay.
First part, it's a 3-part question, everyone. So the first part is for CFC PCS consumers. Who is responsible for submitting a travel request? Care coordinators or provider agency? You want me to read all 3 questions so you can answer them all, or you want me to read one at a time so you can? Okay, go ahead.
I thought I heard like Jeopardy music behind me.
I'm not trying to get
Okay,
caught up,
I got
everybody.
you. I got you.
It's
Doom, doom,
Trying to read
doom,
it.
doom, doom, doom,
We
doom,
need a
doom,
little recording of
doom, 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 doom.
Okay.
Ding.
that. It's going to be the care coordinator. Yeah.
Okay. When a consumer must extend medical travel after approved travel has commenced, how does an agency best communicate that to SDS and get the travel request updated?
You know, for that one, I would probably go through the care coordinator, because when a person is traveling, there's other kinds of eligibility things that have to get worked on. It depends on the length of their travel, and that those details are beyond, you know, the extent of today, our time here together today. Briefly, if people are out of state for a period of time, they need to connect with Division of Public Assistance to keep their Medicaid active. So that's one part. I mean, they don't want to get close to that. So for that, I would just go right to the care coordinator, have the care coordinator, you know, work directly with SDS about that. We do have care coordinator office hours if there's a specific case and somebody's wondering and there's, you know, circumstances and things like that. So best answer is go through the care coordinator.
Okay.
And then number 3, go ahead.
All right. Does an initial waiver consumer apply for personal care service through a CFC 06 app or PCA initial app?
An 06. If they're also applying for a waiver, they should file the 06. If they don't qualify for the waiver, it's okay. They'll be kind of transitioned into a PCA plan. Okay, so best bet if they're applying for a waiver and personal care services, file the CFC 06. If they don't qualify for the waiver, they'll be transitioned to personal care services if they qualify for those.
Okay. So it was asked that I repeat the question. I'm going to just repeat the question. Y'all already received the answer, okay? The first question was for CFC PCS consumers, who is responsible for submitting a travel request, care coordinator, or provider agency? Answer has been given. When a consumer must extend medical travel after approved travel has commenced, how does an agency best communicate that to SDS and get the travel request updated? Answer has been submitted. Does an initial waiver consumer apply for personal care service through a CFC 06 app or a PCA initial app? Okay.
All right, so the summary for each of those is care coordinator is for any CFC case, the care coordinator is the primary submitter of information. The agency and the care coordinator are going to be working together because the agency will have a better understanding of what, you know, needs, what can they assist with as far as DSPs and how they'll be able to assist their client in travel. The care coordinator needs that information when submitting an amendment, when they're documenting that travel request, and when they're filing the travel request form for PCS services. The CFC, same idea. The application, the care coordinator turns in the CFC 06. So if you have a combined case, that's both waiver and CFC PCS, the care coordinator is going to be the lead submitter in that situation. Okay, so hopefully that gives a little bit of clarity. And I think I got caught up in all of the messages that came in. Kara answered a lot of your questions behind the scenes. Thank you for that, Kara. If any of you have additional questions, feel free to put them into the chat. We have all of the topics like that we prepared for you already covered. So what we can do is give you a few minutes to come up with any additional questions that you might have. but there's no reason for us to stay for another 26 minutes if you are feeling updated. So, but I do see some more questions are coming in, so we'll go ahead and take a look at those. But we'll give it just a little bit of quiet time so that you can collect your thoughts and put in that information. All right, so one of the questions is related to how we've had to break services up in Harmony and what creates what I'm just gonna blunt force say is a very ugly overview sheet with multiple providers over and over again. If you have amendments, there may be even more lines, and it just gets to be really cumbersome and difficult to read. And so I'm getting questions, when is that going to be changed? Do you have any updates on that? At this time, we're exploring ways to make that more streamlined. However, I'm going to take this time to do some clarification for you because there's a lot of misinformation on what needs to happen when it comes to breaking down those services. You only need to put in one service if you find the provider and it goes all the way through the plan year. You don't need to break the services up by July 1st at this time. So if you're looking ahead, because you guys are actually like, you're always looking ahead, right? So you're like, I guess I should break up my services now before July 1st. Please don't do that. Just enter the entry once for the full span of the plan and find the provider. That being said, there are times when that's not going to work because something's going on. Either the provider has changed their certification, or you're going back in time because of something happened and you have to go back towards the rate change period of time and amend from there. That's when you look to add the provider, you can't locate them because of that rate change. We're looking on how we can fix that before the next rate change in this upcoming June, July shift. Okay, so we're looking at ways that we can fix that. There are also going to be times when you have to have multiple providers listed because of how the amendment changes over time. You can have one plan year, and in the course of that plan year, have one provider or one service switch between multiple providers. Each time that you have a change in providers, it's a break that you have to stop the service and add the next service. It's also wise to break the provider up when you have a increase in services. So you're amending to increase the service. It's smart to end date the service and then start the next service with the rate increase or the unit increase already factored in for the end of the plan. Clear as mud, I know. It's a lot of detail over something that at the beginning I told you, it's not the support plan, it's an overview sheet. We're aware of that, and so as a division, we are actively looking at a way to make this better, because just as it's difficult for you to enter and navigate these overviews as providers, it's difficult for SDS to follow and track them to make sure that they're correct as well. So we understand that this is not functioning well. So we're working on trying to come up with solutions that are meaningful. So please bear with us as we try to explore that. And we do recognize that it's not working right now. Okay, so hopefully that gives you some clarity. So I'm looking and seeing, I may have
Kara
missed.
answered most of them.
Are there any questions, Kara, that you want to have for the good of the cause?
Yeah, there was a question about an expedite button in Harmony. Were we going to have one? I just said, if you have ideas about Harmony or what things might work better for you in Harmony, I think it's best if you email the details about that. Anybody, our provider group here too. I mean, I know that we're not Harmony users unless we're a care coordinator or PCS admin. But we're always open to suggestions. So SDS Training at alaska.gov. There was a question about adult day. Somebody wanted to have a day of service added. I think the question was more related to like assuming a limit of days in adult day. There isn't a regulatory limit of weekly number of days in adult day that a person can request, but it has to make sense for the person and it can't duplicate other supports. So I guess if a person's already living in an assisted living home with residential supported living, they would have to, you'd have to craft it to tell how it meets that person's needs, and the home is also obligated to meet people's needs for activities and things like that. Anyway, just service duplication in general. And we appreciate your questions about the Harmony related, issues. Deloitte, you did a good job of explaining where we're at with that. So we're not really able to delve into them right now today, but we certainly appreciate hearing about it. And we do have your questions logged in, and we're always working on these things, always. So I guess that's it.
Yeah, well, and like Kara said, we need your feedback from it. We really do, because you're active users and your experiences are valid in what you're encountering. Even if you have, and I've had this happen way more times than what I'd like, you have a user error where like you make a mistake, like that's okay. We still would want to hear about it, because for every one time that it happens to somebody and they tell us, it's probably happened to somebody else at least 3 to 5 times. And we would like to know ways we can make this more streamlined for you any way that we can. We don't always have a solution for it, but we do try. And I do see a couple more Harmony related questions, so I added some feedback in the chats on those. Some of your suggestions have already been forwarded to developers, but it does take quite a bit of time just to go through the chain of like from the user to SDS to the developer, and then back down to you. Like it goes all the way through many levels of communication and testing and developing. So something that seems like it should be an easy fix takes way longer than really seems necessary. But that being said, know that it can't hurt for you to throw those suggestions out there, okay? Because we really value your creative and innovative approaches to getting work done. That's why things get done. It's because of your creative natures. The chats are slowing down again. Back to the overview. So one of the, we thought it would be helpful changes to the overview was that there would be a new and end column on a plan. That overview, new and end columns, are not always accurate. So as a provider and you see that and you're like, oh my gosh, this is not new, or this has not been ended, don't panic yet. You should look at the plan. Any way I can convey to you that that overview sheet is not the legally authorizing document. It doesn't authorize anything. It really doesn't. What authorizes everything is the support plan itself. That's your legal document that billing comes from. The rest of it is like a summary. It's like a cliff note to just take a look at a glance overview of the plan. The real content that you need to be verifying is your support plan section. Like, read the whole thing, but your section is the section you should really key into and ask questions like, is that the right address? Is this the right billing numbers? Like, are units correct? You know, make sure you take a look at those sections and make sure that, you know, it's accurate. But as far as the content on the overview, it is not always accurate, and the care coordinator only has a very limited amount that they can control on it. So they'll frequently ask us questions about the overview, and we have to tell them, don't worry about it, it doesn't matter. But to you, the provider, you're being told by the care coordinator, don't worry, it doesn't matter. Trust me when we say, we understand your concern over it, but the care coordinator is telling you exactly what SDS told them, that really look at the support plan, look at your section within the support plan. There's only so much the care coordinator can control on that overview, and really your key role here is making sure the support plan is accurate. Hopefully that helps. I know that there are so many things to balance, and there's so many, I don't know, like there's just, it's like, you know, when you're cooking a delicious meal and you have to get all of the ingredients, and you just want to be able to look at the recipe and see the ingredients on a recipe card. That's kind of what the overview is intended to be. Right now, it's kind of like a cooking blog, and there's a lot of extra information on it that you don't really need for getting the ingredients to support your person. So make sure you take that into account when you're looking at that overview, and know that the real content you should be looking at is the person's support plan, okay? I think we're kind of slowing down on questions, but you know, if you have more, lay them on us. We're open to your questions, feedback, criticism. This is your time. We may not be able to answer them, but we can forward anything that, you know, needs to be elevated. We'll do that.
I'm not seeing questions come in. I think it's okay to let folks have 10 minutes back. Cost of Full Lives conference this year is still in development. We had a couple of questions about Full Lives, including one about a virtual option. We are still working on that. So just expect all that information to come roaring down, you know, from the teams as soon as we have it. Okay, so it'll probably be a similar cost.
We'll make it a big deal when we have that detail, because you need to know it.
Mm-hmm. Yep. All right. Well, I'm good. I'm good with closing. We're just at about 10 minutes till. We'll post the recording so you can review it on YouTube. And you can double check your understanding. We'll also email you the attachments that were available in the download section, realizing that not all of us are attending on a device that can do downloading. If you're on a phone, you know, or a tablet, sometimes they don't. If you're on a laptop or a desktop, then they certainly will. But don't worry, because we'll send you an email anyway and a link to the recording. Just give us a little bit of time to get that together. Thank you, Delight and Cassandra and Anna, for all your wonderful information. And thank you to everybody for your questions and your engagement. Delight, do you want to add anything before we close? Go
No,
ahead.
just you guys keep being the amazing people that you are and making a difference in our community. We wouldn't be able to do what we do without you and your efforts to support Alaskans. I hope you take this time to not check your email and instead go outside and take a genuine break. Okay, like please do that. The state of Alaska training team is directing you to go take a break with the rest of your time. Okay, all right, enjoy.
Have a good evening, everyone.